Today we're gonna talk about one more topic that includes two viruses that cause one disease and one virus that causes two diseases. Again, two viruses that cause just one disease and one virus that causes two different diseases. Today we're going to talk about herpesviruses. And I consider it's very important, especially for students, to know everything about herpesviruses, because for the last time in our society almost doesn't exist any person who is not infected with herpes virus. In our society almost doesn't exist the person who didn't have chickenpox. So it is a very common issue, and it doesn't matter which is your specialty, you should be aware about these infections. So, starting with two viruses that are causing one infection. It is Herpes simplex with two variants of virus, Herpes simplex 1 and Herpes simplex 2. So they're making part of family Herpesviruses, genus Simplex virus, and species independence, first or second type. We have human herpes virus 1, human herpes virus 2, and subspecies 1 and 2. Talking about their morphology, they're quite similar. Talking about their genetical material, it will be quite similar. The biggest difference between Herpes simplex 1 and Herpes simplex 2 is location. Where this infection will find its location. I guess there is nothing new about it. Maybe even a lot of you you have sometimes some eruptions near lips. So it is Herpes simplex number 1. Herpes simplex 1. Its location, in most of cases, will be around lips. So sometimes it looks like this one. Not too nice, but okay. It's supportable. But sometimes it can be something like this. On what it depends. The mostly important thing you must know about these viruses. Actually, these are sexually transmitted infections. So the spreading of virus will be either during sexual contact itself, either by simple kisses. Especially whenever we are talking about herpes simplex 1. This is why a lot of people are mostly exposed to get this infection. It depends on your personal hygiene. It depends on your personal hygiene, because as long as you have any skin lesions and you get a viral infection, it is not the only issue you can get. As long as you have any viral infection that causes skin lesions, you must be aware that any skin lesion, it is an extra gate of entrance for bacterial infection. So if you don't pay attention to your health, if you don't pay attention to your personal hygiene, and I promise most of students don't care about their personal hygiene. I've been discussing about that, especially in private with my students. So, personal hygiene is extremely important point of every person and especially every doctor. Extremely important point. Taking care of any type of lesions you will have ever in your life. Skin lesions is very important, because whenever you have any skin lesion of any region, there is a chance to get an extra bacterial infection. This is why some people, it is really hard to control this infection. It is really hard to control spreading of this infection, because we have freedom, everybody is doing whatever he or she wants. As a result, we have that much spreading of STIs. But if you wasn't be able to avoid something like this, it is still possible to avoid something like this. If you really care about yourself and if you really care about others. Very simple. By decreasing extra contacts with anyone. If you ever had such symptoms, you've probably been trying using some antiviral creams, right? To treat it, and you probably observed that there is no big difference. Are you applying these creams or not? It will appear and disappear in quite similar period, because very often antiviral drugs are not working too fast. They are working, they are efficient, but usually our immune system is as efficient as antiviral drugs. As a result, even without specific etiological treatment, that means antiviral treatment in this case, even without this etiological treatment, the disease will disappear. And if you remember difference between infectious process and infectious disease, you should remember that infectious process is process that lasts from the moment the pathogen enters the body until the moment after the pathogen disappears, dies, leaves the body. But not all the time infectious process is equal with infectious disease. correct? What is infectious disease? Infectious disease is a result of infectious process with symptoms. For example, right now, a lot of students in this auditory are coughing and sneezing, right? It is infectious disease. Maybe also allergy, because now it's spring, maybe. But you never know until you make lab investigation. Even if you know that you're allergic, presence of allergy doesn't decrease chance of infectious disease. As a result, you show huge irresponsibility by coming here, being sick. That is very interesting. So, infectious disease is impossible without infectious process. But infectious process is possible without infectious disease. Same thing happens in herpes simplex. As soon as you get infected with this virus, in most of cases it will remain with you till the end of your life. And from time to time it will cause a disease. This is what we call chronic infections. When the pathogen persists in your body, and from time to time it causes acute forms of infectious disease. So if you don't have any extra health issues and you get infected with this virus, that's it. Nothing extremely dangerous about it, nothing very good about it. It is just your reality from this moment on. But another infection that would be important to discuss. It is one virus that causes two different diseases, two different infections. And here's the question: how one virus can cause two different diseases, and how this virus decides when it causes one infection, when it causes another one. It is Varicella zoster virus. Or, with other words, it is virus that causes chickenpox and herpes zoster. Who did ever have chickenpox? Raise your hand. So, those of you who had in your childhood maybe, or maybe recently, you had chickenpox, you're lucky ones. Because as older you are, as worse are symptoms, as worse you will feel. As younger you are, but it also depends, because if the baby is too small, is too young, baby is not able to control its movements, and it will scratch itself, and will have a lot of signs of chickenpox till the end of its life, because the skin lesions are a little bit deeper than it can are too deep to regenerate 100%. So you will have scars till the end of your life. This is why it is important to do your best to not scratch these skin lesions, or to not let a child to scratch these skin lesions. So what you have to know, unless you get chickenpox, you cannot get sick with herpes zoster. So if you ever had chickenpox, you have chance to get sick with herpes zoster. If you didn't get infection with this virus yet, your first contact with this virus will be chickenpox. This is the first principle. Now how you diagnose this infection? You know that most of people do not diagnose this infection in the lab, as well as most of viral infections. Most of viral infections are diagnosed basically by symptoms, but not by lab investigations. For a simple reason, most of such infections are treated home. When you get in the hospital with some viral infections, for sure you will get a lab investigation. But most of such infections are treated home. As a result, you never go to the lab just for investigation. Usually you understand by symptoms. Even civils are able, not only doctors, but other people are also able to understand it, to make difference between chickenpox and other infections. How you make difference between chickenpox and other viral infections that includes rashes? By two ways, or by two features. First one, these skin lesions are very characteristic for chickenpox, like a lot of small vesicles that are erupting. From these vesicles, virus is eliminated. Also, such lesions can be present on mucous membranes of the oral cavity, but you never absorb them. This is why chickenpox is spread through the air more than through the direct contact, because virus is present also in saliva. And while talking, while coughing, sneezing, and as well as you don't have to get infected with respiratory infections in order to sneeze or in order to cough, because sneezing and coughing is not only characteristic symptom for respiratory tract infections, but also actually it is these are reflexes of our body on any irritation of mucous membranes. So if you will have mechanical irritation of your larynx or nasopharynx, nasal or laryngeal, pharyngeal mucous membrane, if you have irritation, you will cough or sneeze. Same thing. And you can observe, even if you are not sick, few times a day you can cough or sneeze. It happens. And it will be physiological coughing, physiological sneezing, not pathological. And also you can observe that a lot of people, while talking, sometimes droplets of saliva are flying from their mouth, you know? By the way, usually it happens when a silent person starts talking a lot. Because if you are silent, in most of cases, more saliva is produced. If you are talking a lot, less saliva is produced. It is scientifically proved. So, if you are mostly silent person, but you start talking a lot, sometimes unintentionally you speak in direction of your of the person you are talking with. It also can be, or if you are too irritated, if you are too excited while talking, there is a risk you will spit with a few droplets of saliva in the direction of the person you are talking to. There is a chance to infect someone. So this is how chickenpox is spread from person to person. Usually it happens among children. However, I guess you can prove it. According to some researches, among Indians, chickenpox spreads mostly in adulthood more than in childhood. Is it so or not? Let's check it out. Who had chickenpox in childhood? Like before you went to school or in the primary school, something like that. Who had chickenpox in that period? Okay, who had chickenpox in high school or being here in the university? Still can see a few hands. So, of course, about 100 or 200 people is not too representative data for to prove or disprove the any statement. But still, we can see here more people who've been infected during childhood, and few people who've been infected during adulthood. That corresponds to the majority of spreading of to the majority how it spreads among any population. But still, such research has place. So this information maybe it is characteristic for some specific regions from your country, maybe, but it has place. So what is extremely important for you is, first of all, to be aware if you really been infected ever with this virus, for two reasons. First one, if you find out about an outbreak around you, if you know for sure you had ever this infection, you can keep calm because there is no chance for you to get infected twice. Some people are saying, yes, but I did get this infection twice. It's impossible. It's impossible to get infected with chickenpox twice. And people who are talking about the fact they've been infected with chickenpox twice probably are not sure what they are talking about. For example, in childhood, he or she had an infection that looks similar to chickenpox, and her or his parents are saying, you had chickenpox when you've been 3 years old or 5 years old, and that person doesn't remember that period or all the periods of that age, and that person will trust its parents that because they know better what happened to me in my childhood. And after that, that person is going to school, primary school, after that maybe high school, and there is an outbreak of chickenpox, and he or she gets infected with chickenpox. Can you imagine? I'm that rare case who get infected with chickenpox twice. Wrong. And the first reason is, did your parents make lab investigation in that period? They pretend you had chickenpox? I'm pretty sure they didn't. And even if they did, probably the result was different, but they forgot about that. And after that, I'm not sure if it was chickenpox exactly. Maybe it was measles. Maybe it was rubiola. Maybe I'm not sure pretty much, but I guess it was chickenpox. Just because this title, this name of infection is the mostly familiar for everyone. So probably it was chickenpox. Like when you call every acute respiratory viral infection, you call it flu. But you never know if it is flu or not, unless you make lab investigation. So in this case, the only thing you can know for sure, it is acute respiratory viral infection. That's it. It can be flu, it can be coronavirus, it can be adenoviral infection. A lot of different viruses are causing similar infections. Same thing can happen to chickenpox. And the second reason why it is impossible to get infected twice with chickenpox, because as soon as you get infected once, the virus will not leave your body ever. And here we are coming to the Herpes zoster. Here we are coming to Herpes zoster disease, and here is how we get infected with this infection. First, you get infected with chickenpox, with varicella. You get healed completely. That means you don't have any diseases, any symptoms anymore. But the virus migrates from skin into nervous system, and it stays in the dorsal ganglions of the on the spinal cord. So it just hibernates in those neurons. But the virus persists in your body till the end of your life. So whenever somebody gets sick with herpes zoster, it is not reinfection. It is not like you've been infected from someone and you get sick with herpes zoster. It is reactivation of the virus that starts multiplying on the trajectory of the nerves from the spinal cord. So this is how you make difference between chickenpox. You know how rashes with vesicles are looking in chickenpox, and this is Herpes zoster. So it can go on the trajectory of the nerves from the neck, or maybe on omoplate, on shoulders, on the direction towards shoulders, or on the trajectory of ribs, between ribs, or lower. So on the entire spinal cord, from nerves, from middle and forward. Not every time not every time bilateral, not every time on the entire surface of your back or neck. Very often it happens just on one place, in one place, like here. The reason why this virus will reactivate are not clear till now. Probably there are different factors that can be trigger for this for reactivation of this virus. But good news for those who didn't get any infection with chickenpox till now, that you have no chance to have herpes zoster unless you get infected with chickenpox. Can we avoid it? Yes, we can. How can we avoid it? By vaccination. So, for example, there are some parents, that's very interesting and basically weird and dangerous, that there are some parents who heard that it is better to get infected in childhood. So when they hear that there is a place where we have an outbreak of chickenpox among children, they bring their children in that place to let them get infected. Guys, please keep in mind, it is extremely stupid. This is extremely stupid. There is no there is no smart and logical explanation for such activity. I want you to understand something very important, that even if in most of cases in the childhood symptoms will be lighter than in adulthood, it doesn't mean there is no risk for a child. First. And second, there is no way that vaccine to be more dangerous than the infection itself. So, as long as vaccine is available, why should I bring my child in the middle of outbreak just to make my child immune? Go to the polyclinic and require a vaccine. It doesn't make part of the mandatory immunization. So it is optional vaccine. Maybe you will have to pay it, and I would like to pay it. I'm ready to bring my child in the polyclinic and to require vaccination against chickenpox in order to reduce chance for infection with chickenpox. Because do you remember how you've been treated against chickenpox? Who've been like Shrek or like Hulk, green? Yes, right? So your parents have been painting with green of brilliant every point of eruption. It is very good. Of course, you will be green for a long time. So some people invented colorless antiseptics. Why do we paint it? Paint all the eruptions? Not because it kills virus, basically, because it is antiseptic substance, As soon as it will erupt, as soon as we will have a skin lesion, it decreases chance of superinfection, bacterial superinfection. Because as more skin lesions you have, as higher is the chance to have bacterial superinfection. You should keep in mind, your skin is full of bacteria every day. It doesn't mean how often you wash yourself, how often you take the shower with antibacterial soap, with whatever you want. It doesn't matter. Your skin is full of bacteria. Normal flora and conditionally pathogenic flora. So as more skin lesions you have on your body, as high is the chance to get infection. So I saw a lot of cases when a child with chickenpox has very bad bacterial skin infections, and what is even worse, it can migrate from skin under the skin, so it will affect the entire subdermal layer. So it is extremely dangerous, because this infection can already be very widely spread, for example, on the entire back, with a huge amount of pus production. So you will need to go to the surgeon to cut the skin, to eliminate all the pus from there, to make the drainage of the washing of this cavity. And this is not the worst thing that could happen. It can lead to sepsis, and it can lead to death. What is extremely weird, that parents who are accepting making something like that to bring their child in the middle of outbreak of chickenpox. That's very interesting. They're against vaccination. So please keep in mind, there is no way vaccine to be more dangerous than the infection itself. This is why, as long as you have a chance to get vaccination, you get vaccination. Risks will be much lower than the disease, any disease. It doesn't matter we are talking about chickenpox, we are talking about flu, coronavirus, mumps, measles, whatever. All the time, it is better to get vaccinated, not to get sick. So why it is also very important, and in my opinion it is better to apply this type of antiseptic in case of chickenpox, especially while you're adulthood, because if it is a child, believe me, it is fun for a child. Are you green? I am also green. Do you have pictures from your childhood when your entire body is green? I also have. I have. Yes. Unfortunately, I didn't find to show you, but I also have such pictures. So for children, it is just fun, because a little bit of subfebrile temperature, a little bit of itches, of course not really pleasant, but still it's supportable, and the entire body is green. But when we are talking about adults who get infected with chickenpox, what do they say? No, I cannot paint my skin with green. Why? If I need to go to a supermarket, and everybody will be looking at me and will be laughing. First of all, please don't think that anybody cares about you. Second, why should you go out while you are infectious? So, it is protection for society, not only for you. It is protection for society because you will feel uncomfortable to go with such appearance outside, right? So you will stay home. I'm pretty sure there is nothing impossible by finding someone who could provide you with everything you need, medicines, products, foods, whatever. But it is very important to keep responsibility and to think not just about you, but also about others. Because you never know with whom you will enter in contact. Maybe that person is already old and didn't ever get infected with chickenpox. And you will go just to buy some chips or some whatever. You go out for your own needs, maybe not that important. By accident, you enter in contact with an old person who didn't ever get infected with chickenpox. You infect that person. You know that as older you are, as worse will be the clinical manifestation of this disease, and that person can even die. And it will be your responsibility. Probably you will never know about that. Probably you will never know that who is that person whom you infected and who died because of you. But you must know, if you will admit something like that, there is a high risk you will kill somebody by this action. So it is your responsibility. This is why I find this way of treatment the mostly efficient one, the old one and good one. So while we are talking about treatment of varicella or chickenpox, while we're talking about treatment of chickenpox, supportive care is basically the only treatment. Sometimes we can apply antiviral treatment in some more complicated cases when our immune system is not able to protect ourselves. But usually it is not a big deal for our immune system. This is why supportive treatment is enough for chickenpox. And supportive treatment is equal with symptomatic treatment. We can have, as well as we already discussed, etiological treatment. In case of viral infections, it is treatment with antivirals. In case of bacterial infections, it is treatment with antibiotics. In case of fungal infections, it is treatment with antifungal drugs. So specifically in chickenpox, antiviral therapy is not that spreaded just because symptomatical treatment in most of cases is enough. What is symptomatical treatment in case of chickenpox? It is antiseptic application of on eruptions on skin, and according to your symptoms. You have fever, apply antipyretics. Maybe you have tiredness, like in most of viral infections. How you treat tiredness? With rest. Stay home. Don't go out. Stay home and take rest. In any viral infection, tiredness is one of the mostly specific and mostly ignored symptoms. Please don't ignore tiredness in any infection, in any disease. It is a symptom, extremely important symptom that you must treat. And it is for free and you have it home. You just stay in bed and take your rest. That's it. Don't come here. Don't infect others. Even if that means you will have to pay after that your absence. I already told. Because for you it will be 15 euro. Maybe. And maybe not, if you will finally make your medical leave. But for others it can be much more expensive. This is why you must assume your own responsibility. For example, right now here in this auditory, I know there is a student who is sick and needs this treatment, needs having rest, staying home. And what she's doing now? She's having rest here. She's sleeping here right now. Just to not... and now we discovered a group of such people, right? I'm not sure if all of them are sick. But you come here, you infect others, but you avoid absence. This is how you show your professional responsibility. And now ask yourself if you deserve to become a doctor or not. Extremely important, guys. The best prophylaxis. Please keep in mind, different types of diseases, different types of infections, and especially according to the way of transmission, are prevented specifically by different ways. Whenever we are talking about infections that spread through the air, airborne infections, and it is not all the time only respiratory tract infection, because chickenpox is airborne infection, but it is not respiratory tract infection. Whenever we are talking about airborne infection, there is no better way of prevention, no better way than vaccination. It doesn't mean we shouldn't respect other measures of prophylaxis, like wearing masks, like isolating ourselves when we are sick, and so on. But the mostly efficient is vaccination. So, first of all, we apply vaccination, and after that, we apply others, like isolation, wearing masks, and disinfection, and so on. When we are talking about intestinal infection, there is no better prophylaxis than personal hygiene. Washing everything. Washing yourself, washing your hands, washing everything around you, washing your clothes, washing your place, drinking safe water, and consuming safe and clean fruits, vegetables, foods. But on the first place, we have personal hygiene. If we are talking about some disasters like flood, in such case, vaccination also is very important against some intestinal infections. When we have epidemiological situation. But on a daily basis, the best prevention of intestinal infection is personal hygiene. While we are talking about infections that are spreading through the blood or through the direct contact, including sexual contact, there is no better way of prevention than detecting source of infection, isolating source of infection, and treating source of infection. So all the time when we are talking about prevention, we have 3 points we should work on. It is source of infection, way of transmission, and receptivity of population. Talking about source of infection, we need to isolate and to treat source of infection. Talking about way of transmission, we need to apply disinfection, sterilization, personal hygiene, and so on. Way of transmission. And while we are talking about airborne infections, we are talking about vaccination. So extremely important on the first place to apply vaccination. We have vaccination against both, of course, because it is caused by the same virus. We have vaccination against chickenpox and we have vaccination against Herpes zoster. If you have any questions, you can ask. Probably you don't have any. So wish you good vacation and see you in 2 weeks.